So if I told you that the tiny, practically microscopic blood vessels in the clitoris could actually act as your body's absolute first warning siren for a major heart attack, you would probably wonder why nobody is scanning them during a routine checkup, right?
Right. I mean, it seems like such an obvious thing when you look at the data.
Exactly.
Huh.
Well, today we are looking at the science that does exactly that. So welcome to this deep dive. And if you're joining us, it means you're someone who really likes cutting through the noise to find the real measurable data. And I got to say, the stack of sources you provided for us today is, well, it's a wild ride.
It really is. The contrast in these materials is just fascinating.
Yeah, because we are looking at these super glossy medical spa brochures promoting this massive trend in female sexual wellness, a procedure known as the O shot. And those are piled right next to incredibly dense peer-reviewed medical studies on clitoral hemodynamics, sonographic imaging, vascular resistance.
Right. So we have this highly enthusiastic, almost evangelical marketing on one end of the spectrum, and then this rigorously controlled, deeply clinical data on the other.
Totally. So our mission today is basically to bridge that gap. We are going to separate the marketing claims from the actual measurable science. We want to understand what the O-shot claims to do, sure, but more importantly, we're going to explore how researchers use this really cutting-edge tool called real-time Doppler ultrasound to, physically track changes in blood flow.
Yeah, we're looking at how this technology acts as a sort of objective lie detector, really, to prove whether treatments like this actually work on a cellular level.
All right, moving away from just subjective feelings to, well, concrete, undeniable video evidence of your vascular system reacting.
Exactly.
So let's start with the O-shot itself, also known as the orgasm shot. This was developed by the same doctor who created the vampire facelift, and it has just become this incredibly popular offering at clinics everywhere. Like, we see the ads, we see the claims, but what is actually happening in the room?
Right. Well, the brochures in our sources describe it as a non-surgical, minimally invasive procedure. Takes less than an hour. But it does involve your own blood.
Right, which sounds intense.
It does, but the core biological engine of this whole procedure is platelet-rich plasma, or PRP. So the process begins with a standard blood draw from the patient's arm. That vial of whole blood is then placed into a centrifuge, which, spins it at extremely high speeds.
Okay.
And it uses a very specific gravitational protocol. The goal there is to force the heavier red and white blood cells to the bottom of the tube, leaving this concentrated golden layer of plasma floating at the top. And that layer is heavily populated with platelets.
Okay, so, I understand platelets stop bleeding if you get a paper cut, right?
Uh-huh.
But how does injecting them into genital tissue theoretically regenerate anything? Like, what is the actual mechanism there?
It's actually really cool. Platelets are these fascinating little shapeshifters. Beyond just clotting, they carry these microscopic payload packets called alpha granules.
Alpha granules, okay.
Yeah, and when these platelets are activated, they basically crack open and release a massive dose of growth factors into the surrounding tissue. Think of these growth factors as like a chemical signaling flare for your body's dormant stem cells.
Oh, wow. Okay, so it's calling in the biological scaffolding to rebuild.
Precisely that. So the theory behind the O-shot is that by numbing the genital area and injecting this highly concentrated PRP directly into the clitoral glands and the anterior vaginal wall, you are forcing a localized healing response.
Interesting.
Yeah, the growth factors stimulate this process called angiogenesis.
Which is the creation of new blood vessels, really.
Exactly, brand new blood vessels. And they also trigger the production of new collagen and supposedly accelerate nerve regeneration. So you aren't just, temporarily dilating existing vessels, you are theoretically building a younger, more robust vascular network from scratch.
That's wild. And the reported benefits listed in these clinical brochures are massive. Clinics are reporting patients experiencing stronger, more frequent orgasms, increased natural vaginal lubrication, a sharp reduction in pain during sex, and even relief from mild stress urinary incontinence.
Just a long list.
It sounds like a total panacea for female sexual dysfunction.
Yeah.
But I do have to push back here.
Yeah.
Because I'm looking at the medical literature in our sources, and it explicitly states that large-scale, randomized, peer-reviewed evidence for the O-shot is highly limited.
It is.
Right. Most of the data comes from small case series or subjective patient surveys. And, if a patient pays over $1,000, gets a blood draw, and then has an injection in a highly sensitive area, they're going to be hyper-aware of their body.
Absolutely.
So isn't this just a massive, incredibly expensive placebo effect? Like, how do we actually know the blood flow is genuinely increasing and not just in their heads?
Well, that is the exact crucial flaw with relying on subjective surveys, right? where a patient rates their arousal on a scale of 1 to 10. You just cannot prove a complex cellular process like angiogenesis with a questionnaire.
No, definitely not.
To know definitively if a regenerative therapy is working at a vascular level, science demands an objective physical measurement. We basically have to look under the hood.
Okay, so subjective surveys are out because of the placebo effect. But how on earth did the researchers in these papers actually prove the blood was moving? I mean, you can't exactly stick a standard, bulky hospital ultrasound on a clitoris.
No, you definitely can't. You need a highly specialized tool for this. For evaluating clitoral hemodynamics, researchers utilize a high-frequency external doppler ultrasound. It typically operates around 12.5 megahertz.
Okay, and the high frequency is important because it changes how the sound waves interact with the tissue, right?
Yep. Yeah, exactly. High-frequency sound waves don't penetrate very deep into the body, but they provide incredibly high-resolution imaging for superficial structures. And since the clitoral arteries sit very close to the surface of the skin, 12.5 megahertz is basically the perfect frequency to capture them.
That makes sense.
So the diagnostic process has two distinct phases. First, the sonographer uses what's called grayscale mode.
Okay.
This produces your standard static black and white image, and they use this purely for anatomical mapping. They're inspecting the structural integrity of the erectile tissue within the corpora cavernosa, and they're measuring the thickness of the tunica albuginea.
Which is what exactly?
It's the tough, fibrous sheath that surrounds that erectile tissue.
Ah, okay. So grayscale is sort of like looking at a high-resolution photograph of a highway. You are checking for structural damage, making sure there are no potholes or roadblocks.
That is a perfect way to visualize it, but checking the pavement doesn't tell you anything about the actual traffic.
Yeah.
To see the traffic, that requires the technician to switch to duplex Doppler mode.
Oh, the Doppler effect.
Yeah, it allows the machine to detect motion by bouncing sound waves off the moving red blood cells. So suddenly, that static gray image gets an overlay of color, usually these vibrant reds and blues, providing a continuous real-time video feed of the blood physically pulsing through those tiny cavernosal arteries.
Wow, okay. So the Doppler mode is our live traffic camera, showing us the speed of the cars in real time. And just like a traffic camera, I'm assuming there is a specific speed metric researchers are looking for to prove this actually works.
You're spot on. The defining metric in these studies is called peak systolic velocity, or PSV.
PSV, got it.
And it is measured in centimeters per second. PSV represents the absolute highest speed the blood reaches as it forcefully rushes into the clitoral arteries during the systole phase of the heartbeat.
Which is the exact moment the heart muscle contracts.
Exactly. It is an undeniable physical measurement of the tissue's capability to engorge with blood.
Okay, but getting a reliable measurement of that speed can't be as simple as just putting a probe on someone's arm. I mean, this is a highly sensitive area, and we all know sexual arousal is notoriously fickle. If someone is stressed or anxious, that speed is going to plummet, right?
Oh, absolutely. The methodology required to get an accurate, unskewed PSV reading is intensely rigorous. According to the clinical trial protocols we're reviewing in your sources, a patient cannot just walk in off the street for this scan. They actually must abstain from all sexual activity, including masturbation, for at least 12 hours prior.
Just to ensure their baseline blood flow isn't artificially elevated.
Exactly. You need a true baseline. They are also required to void their bladders immediately before the scan.
Why is that?
Well, a full bladder can physically displace the surrounding pelvic anatomy, which puts external pressure on those tiny blood vessels and artificially restricts the flow.
Oh, wow. That makes perfect sense.
Yeah. Once prepared, the patient lies down in the lithotomy position on their back with legs separated in a quiet, strictly temperature-controlled room.
Wait, hold on. Why does the room temperature matter for an ultrasound?
Because human physiology is wired for survival. If a patient is cold, or even if they're anxious because the room is noisy, their sympathetic nervous system kicks in. Their peripheral blood vessels will instantly constrict to keep warm blood near the vital organs.
Oh, right. The fight or flight response.
Exactly.
Wow.
That natural vasoconstriction would completely ruin the accuracy of the baseline PSV reading.
Wow, the sensitivity of the body is just wild. But I do have a mechanical question about the probe itself,
Sure.
because we're talking about clitoral arteries, which are incredibly small. If a sonographer takes a hard plastic ultrasound probe and presses it physically against a tiny artery to get an image, won't the physical pressure of the probe just crush the vessel? Wouldn't that completely bottleneck the blood flow you are trying to measure?
It absolutely would. That is actually a major hurdle in this field, and it requires highly specialized sonographic training to overcome. To prevent acoustic impedance, which is the resistance sound waves face when moving from the probe into the body, technicians use a massive amount of neutral ultrasound gel.
Okay.
And it is critical that this gel is completely neutral. It can't contain any active warming or cooling ingredients that might artificially stimulate the tissue.
So the gel basically acts as a liquid bridge.
Exactly. It allows the sound waves to travel clearly without the technician needing to mash the hard probe against the skin. The sonographer must apply a uniform feather-light touch. If they press even slightly too hard, they will artificially flatten the artery, and the PSV data becomes completely invalid.
That sounds incredibly difficult to do perfectly. Okay, so we have this incredibly sensitive, highly controlled live speed camera. How do researchers use it to actually prove a treatment works?
Well, our sources highlight this brilliant 2022 clinical study that demonstrates the power of this technology perfectly. Researchers wanted to test a topical gel containing the amino acids L-arginine and L-citrulline to see if it actually increased blood flow.
Oh, I know those. Those amino acids are often found in pre-workout supplements, right?
They are, yeah.
Because they act as chemical keys that signal the body to produce nitric oxide. And nitric oxide is a powerful vasodilator. It physically unlocks the smooth muscle in the artery walls, allowing them to relax and balloon outward so more blood can rush in.
That chemical process is exactly what they wanted to track. So the researchers brought the women into the temperature-controlled room and first applied a totally neutral placebo gel.
To prove that just rubbing a gel on the area wasn't responsible for any vascular changes?
Exactly. You have to control for the physical touch. Using the doppler, they established a baseline PSV in the right deep clitoral artery of 6.19 centimeters per second.
6.19 centimeters per second. Okay, that is our starting line.
Right. Once that baseline was locked in, they applied the active amino acid gel. Just 5 minutes post-treatment, the Doppler tracked the PSV rising to 8.57 centimeters per second.
Wow, so a noticeable bump very quickly.
It goes much further, though.
Huh?
Look at the reading at 15 minutes post-treatment. The PSV spiked to 13.9 centimeters per second.
Wait, it more than doubled in 15 minutes?
Yes, it did.
And we know this isn't subjective because the Doppler is watching the red blood cells physically move faster on the monitor.
Exactly. The Doppler completely eliminates the guesswork. And this diagnostic precision applies across multiple interventions, too. Another study in our stack looked at the effects of oral sildenafil.
Which is the active ingredient in Viagra, right?
Yes, they looked at it in postmenopausal women. The ultrasound showed their clitoral PSV increased from a baseline of 12.9 up to 17.9 centimeters per second in just an hour after taking the medication.
That's incredible.
And even non-pharmacological treatments leave a vascular footprint. Researchers applied vibratory stimuli to the mons pubis for 2 minutes, and the Doppler caught the PSV jumping from 11.2 to 15.5 centimeters per second.
Okay, so if a temporary gel can double blood flow in 15 minutes, what does the Doppler show for a permanent PRP injection, like the O-shot? Like, how do we use this speed camera to definitively prove the O-shot works?
Well, that is the exact focus of the most cutting-edge research happening right now. To track changes before and after an O-shot series, a practitioner basically designs a longitudinal Doppler study. First, you bring the patient into the controlled environment and map their baseline PSV.
Just like the gel study.
Right. Then you administer the O-shot PRP injections.
And because angiogenesis, the actual building of new blood vessels, takes time, you obviously don't scan them immediately, right?
Yeah. Correct. You send the patient home and allow those growth factors to activate the stem cells and literally lay down that new vascular architecture over several weeks or even months. Then you bring the patient back into that identical temperature-controlled room, apply the neutral gel, use that feather-light touch, and measure the PSV again.
I see. So if the O-shot actually regenerated the tissue and created new vessels, the baseline PSV will be permanently higher. The traffic camera proves the highway has physically added more lanes.
Exactly. It completely dismantles the placebo argument. The blood is either moving faster through newly generated vessels or it isn't. It's binary.
That is so cool. But there's another metric buried in these hemodynamic studies, and it seems to imply that doing this Doppler scan isn't just about measuring sexual arousal. It suggests that looking at these specific vessels gives us a window into systemic health.
Yeah, this is where the science really shifts from sexual wellness to life-saving diagnostics. When the Doppler ultrasound measures the blood flow, It automatically calculates a secondary metric alongside the peak systolic velocity. It's called the pulsatility index, or PI.
Okay, and what exactly does the pulsatility index measure?
It measures the mathematical difference between the high flow speeds during the heart's pumping phase and the low flow speeds when the heart is resting. In physics terms, it is a direct measurement of vascular resistance.
Okay, let's use a plumbing analogy for this. Because these arteries are so small, they kind of act like a tiny pressure relief valve or a microfilter in your house's plumbing.
That's a good way to look at it.
Right, so if the hose is wide and elastic, water flows through it smoothly and easily. But if that hose is stiff, narrow, or calcified, the pressure builds up, and the flow becomes highly pulsatile. The water surges forward under pressure, then forcefully stops, then surges and stops.
That is the exact mechanical reality. A high PI reading on the Doppler means those clitoral arteries are stiff, narrow, or clogged. Now, why does this matter so much? It comes down to basic human anatomy. Clitoral arteries are incredibly tiny. They have a diameter ranging from 0.7 to 1.1 millimeters.
That is vanishingly small, just sub-millimeter.
To give you some clinical context, penile arteries, which perform an identical erectile function in men, average 1 to 2 millimeters in diameter.
Wait, so they are almost twice the size?
Yes, they are much larger. Because clitoral arteries are sub-millimeter in size, they are extraordinarily sensitive to metabolic damage. If there's any mineral buildup, plaque, or loss of elasticity anywhere in your vascular system, this tiny microfilter is going to be the very first thing to clog and sputter.
Ah. So a high PI in the clitoris is an early alarm bell. It's going to show resistance long before the larger arteries in your heart or your brain show any signs of a blockage.
Exactly. The clinical findings back this up with startling clarity. Studies show that a high clitoral pulsatility index is a massive harbinger of systemic cardiovascular risk.
Wow.
For instance, the literature shows PI is significantly higher in heavy smokers compared to non-smokers. The toxins are actively stiffening those tiny genital vessels. Furthermore, PI is significantly elevated in women with obesity, metabolic syndrome, and insulin resistance.
Actually, the sources went into a lot of detail on diabetes specifically, explaining how it physically damages the tissue.
Yeah, the evidence there is severe. Diabetes causes higher collagen condensation, which is essentially the formation of rigid scar tissue and smooth muscle atrophy in the clitoral tissue. The vessels literally lose their mechanical ability to relax and expand. In postmortem autopsies, researchers have established direct associations between this specific type of clitoral smooth muscle atrophy and actual cardiovascular mortality.
Just think about what that means for you. If you were sitting in a doctor's office today, if a woman is experiencing a drop in physical sensation, a lack of arousal, or difficulty reaching orgasm, a condition the medical field diagnoses as vasculogenic female sexual dysfunction, it might not be a localized, isolated issue.
It is rarely just a sexual problem.
Right. That drop in sensation, caused by a lack of blood flow, could be your body's absolute first warning sign of peripheral vascular disease, or atherosclerosis. It means your cardiovascular system is under systemic stress.
And this requires a profound paradigm shift in medicine. We have historically isolated sexual health from systemic health, particularly in women's medicine. But the Doppler ultrasound proves they are biologically inseparable. The structural health of the clitoral arteries is a direct mirror reflecting the health of the entire cardiovascular system.
It really reframes the entire conversation around why we seek out these treatments in the first place, doesn't it? We started this journey looking at the glossy marketing of the O-shot, the exciting idea that we can use our own platelet-rich plasma to rebuild tissue and restore sexual wellness.
Right, and then we moved beyond the marketing to see how science actually demands objective proof. We explored how real-time Doppler ultrasound acts as this ultimate physiological lie detector, tracking the exact speed of blood through peak systolic velocity to prove whether new vessels are truly forming.
And finally, we discovered that the resistance inside these tiny sub-millimeter vessels, measured by the pulsatility index, is intimately tied to your total body health and your risk for heart disease. Which, leaves you with a really fascinating question to ponder as we wrap up.
Oh.
Yeah. If clitoral arteries are significantly smaller than penile arteries, and therefore they show signs of vascular resistance and cardiovascular disease much earlier, shouldn't clitoral Doppler ultrasounds stop being viewed merely as a niche test for sexual dysfunction?
That's a great point.
Shouldn't they instead become a standard life-saving preventative screening in routine women's healthcare? I mean, it seems like a no-brainer. But thank you so much for joining us on this deep dive. Keep questioning the status quo, keep digging into the real science behind your health, and we will catch you next time.